Hey, Assalamu alaikum. In this video, we will understand about the nerve injuries. So, classification, the nerve injuries classification. We will discuss on the Seddon's classification and Sunderland's classification. In 1951, he classified the nerve injury in 1951. So first of all, we should need to understand the central nervous system and peripheral nervous system and the spinal cord and where the injury can be possible. So let's understand about that. So basically, the major injury also occur due to the burning or injury in the peripheral region, but the central nervous system also involved. Here is the different type. Here is the dorsal and ventral cross-sectional view of the spinal cord, and this is the peripheral nervous system, and the central nervous system contain brain and spinal cord, while the PNS peripheral nervous system contain a sensory and motor neuron. This is the white matter and gray matter. Gray matter inside of the butterfly-like structure in the spinal cord, while opposite in brain. Here is the stretching will lead to cause injury, and this is the stretch injury. The avulsion, which that stretch injury is also due to the accident or some other things. Avulsion is the detachment, semi-detachment of the dorsal root of ganglion. So totally not intact with the spinal cord. So on the other hand, here is the epineurium, which does contain a lot more fascicles. This fascicle contain many perineurium, which that perineurium contain many endoneurium. This endoneurium contain a basal lamina, Schwann cell, and myelin sheath, and the axon, which that is a single nerve fiber. So in this way, important thing is that the Seddon's classification, if you are thinking about that, so the Seddon's classification, first of all, divided into the three classification, the three sub-classification of the Seddon's classification, the neuropraxia and axonomasis and neuromasis. So in this way, here is the single neuron which that's surrounded with the epineurium, perineurium, and endoneurium. So in this way, anyhow, this is the three layers. So I hope you make sense about that. So the neuropraxia is the conduction block. So this is the mildest form of nerve injury, temporary loss of nerve function, but nerve not damage. So nerve not damaged, but temporarily blocked, so it can be recovered. So in this way, the numbness, tingling, and some other move less activity, and in this way, while the second one is the axon masses. So the axon masses mean the a severe injury, axon damage, and but the surrounding connective tissue intact. In this way, recovery is several months or may not complete it. So the axon will divide, but the other layers will not divide. On the other hand, the neuromasses mean the most severe injury and not recovery. So the total damage and the separation of nerve. So in this way, the epineurium and perineurium, even endoneurium and axon will divide. So that will be difficult to again repair, but some injury can be repaired and reverse. So let's understand about the Sunderland's classification. So Sunderland's classification we can classify in the 5 stages: first degree, second degree, and third degree, as well as fourth and fifth degree. So the first degree is the equal to neuropraxia. So the same like the conduction block. So this is a mildest form of nerve injury and a temporary loss of nerve function, but nerve not damage. While on the other hand, the second degree equal to axon masses. The axon masses mean the breakdown of the axon, while other will be intact, other layers, and a myelinated Schwann cell also retain. The third degree is the damaged nerve fibers axon plus endoneurium, while the fourth degree is endoneurium and perineurium will be damaged. And the fifth degree is this involves the neuromasses. So again that things detached full. So the diagnosis and treatment can be image test, MRI, CT scan, surgery to repair, and more damage to irreversible. If the more damage, so the irreversible, not a repair. Let's understand on the cellular level, the injury will occur. So in this, the injury will occur will lead to uh, segmentation of the axon and not intact. In this way, the remember about that thing. This is the Valerian degeneration will occur, and in this way, after a 2 week after injury, the degenerating myelin and the sheath Schwann cell will again repair, but in this way the macrophage activation, this macrophage will basically clear up the all debris which that after the injury, like the myelinated injury and other axon injury. So in this way, important thing you should need to understand the again repair of the axon in the 3 week, after 3 week. So after 3 week, so proliferation, the Schwann cell, and on the other hand, the axon, in this way, the neurogenesis process will begin. In this, the certain type of the growth factor will work to proliferation, the proliferation of the Schwann cell. In this, a Schwann cell will proliferate, while the muscle will lead to shrink, is known as atrophy. So again, repair to again regeneration of the myocytes and the muscle. So in this repair regenerate, but important thing you should need to understand is that the severe injury not recoverable, like full break, spinal breakdown, brain traumas, and other peripheral nervous system injury, but it should be severe if the irreversible, but it can be reversible. I hope you make sense about that. So in this way, the severe injury not recoverable, like the full break, spinal breakdown can be irreversible. So in this way, the whole body will paralyze if where the conduction will occur. So the whole body, for example, and the brain traumas, severe trauma, and other peripheral nervous system injury. So I hope you make sense about that. In this video, we have discussed about the nerve injuries, classification, Seedon's classification, and Sunderland's. Thanks for watching. Bye.